Hey everyone, and welcome to Chef AJ and Friends. Today is the second Wednesday of the month, which means it's time for Can Fasting Save Your Life? A Q&A with Dr. Alan Goldhamer, the co-founder of the TrueNorth Health Center. Please welcome him back to the show. Hello, Dr. Goldhamer. How have you
Hello,
been?
AJ.
Hey, so we had a pretty fun experience last month, didn't we?
We did.
8 days at Rancho La Puerta with you and your lovely wife and myself and our small group. And we're doing it again next year, July 19th to 26th. Spots are limited, so I'll put something in the show notes if people want to join us. So was that your first time at Rancho La Puerta?
Yeah, that was a very great experience. They have 4,000 beautiful acres there. I think the highlight was they have a 6-acre organic garden that they grow a lot of the food that they serve there. And that was really, really interesting to see how they process these organic fruits and vegetables and their composting methods and their, the different techniques they use to grow. I found that really interesting.
Yeah, and they have basketball.
They have basketball, which is really such a great treat to play basketball. They have a nice court, and that was very enjoyable. Wouldn't want to have to go a whole week without playing a bunch of basketball, so that was good. They also have pickleball, which I played for the first time, and I found
And
that
I'm told
interesting.
that you were very good.
It's like ping pong, only on steroids, you
And
know? So
I think, yeah, I was told you were very, very good, but basketball's still your first love.
yeah, pickleball is not basketball, but it was interesting, and they have a lot of different activities there. I noticed they had a lot of hiking, and we went on some really nice hikes that was enjoyable.
And you were able to get food that you could eat, right?
Yes, well, I think because of your group being there, they have an SOS free option. And so they'd have one line, which was their regular food, and then the one line that was all SOS free. And so we didn't have trouble finding healthy food to eat. And what was really nice was their vegetables, because so much of them are grown there in their gardens, they were really quite good. Their
Absolutely.
greens and stuff were exceptionally good.
Yeah, they really were. They really were. And it's my dream to when we go back next year to have Dr. Lisle be there as well, so you guys can play some serious
Yes.
basketball. So
Yeah, that would be good. And you guys did really well with the basketball. We had some women there all playing basketball. We went through and worked on different aspects of it. That was fun.
well, you showed us how to shoot, and you really are a 90% free throw because every 10
Yes, I
attempts,
am.
he got 9 of them in. So that was amazing.
Yeah.
Speaking of Dr. Lisle, did you happen to know it's his birthday today?
Yes, I do. They celebrated, September 11th. That's what the big celebration is always about, Dr. Lyle's birthday.
Yeah, fantastic. Well, thank you, Dr. Goldhammer. And don't forget, get Dr.
Yeah,
Gold.
and this is a big birthday for him because now he's also 65 years old. So
Yeah. So he
he's
finally is on. Finally, I'll be
he's also an
joining.
AO, an
Well,
ancient one.
I will be joining you guys next March in the 65 Club. And the best thing about being 65 is health insurance goes way down because we're men
Yeah,
on
yeah.
Medicare.
Yeah, you get all
That's
those senior discounts.
that's the best part. Yeah. So I joke that when I'm on Medicare, I'm going to have every procedure just because it's been so hard my whole life with insurance companies fighting for everything. And I'm like, I'm going to give me a brain transplant. I don't care. I just want to take advantage of low cost health insurance for the first time in my life. I'm kidding, of course. All right. So we'll jump right into the questions. The first one is from Anonymous. We get a lot of people named Anonymous. And the question is, how much fiber is optimal when eating a whole food plant-based diet? Is 40 grams too little? Is 100 grams too much?
Well, there's going to be a bit of variation. So we want to think of a couple things, AJ. Number one, how much people eat varies from person to person. For example, if you're an 85-year-old, 100-pound female that doesn't engage in vigorous manual labor, you may not eat the same amount of calories that a 26-year-old that's doing roofing for a living, might eat. And the variance can be quite huge. For example, some people might be eating 1,800 calories. Other people might be getting 3,500 calories in order to maintain optimum weight. So if you eat twice as much, you also would get twice as much fiber. So I think it's misleading to talk about specific grams of fiber as an ideal. But what I can tell you is that when people eat a whole plant food diet, and they're not getting 25% of their calories from refined carbohydrates and 20% of their calories from alcohol and using a bunch of dead decaying flesh and other processed foods that have no fiber, you're going to get a whole lot of fiber, and it's going to be many times the fiber that people are eating on a conventional diet. And that's why when people get enough fiber, they stop having as many of the bowel difficulties. Because when you don't get enough fiber, like for example, meat, fish, fowl, eggs, and dairy products have zero fiber. Sugar has zero fiber. Refined carbohydrate, zero fiber. So the majority of people are eating maybe 70, 80% of their calories from ultra-processed foods. They're not getting any real fiber. And as a consequence, their stools get hard, and then they strain, and then they get downstream consequences. They get varicose veins, they get hemorrhoids and fissures, and they have prolapsed uteruses, and they have difficulties with organtosis and other problems. And so by going on a whole plant food diet, you're going to get, could be 40, 50, 60, 80, maybe even 100 grams of fiber a day. And as a consequence, you're not going to have the bowel problems and constipation that's so epidemic in society today. And all of the downstream consequences that come from chronic constipation are also going to be mitigated. So I don't think we have to worry about how many grams exactly there are of fiber. What we should be focusing on is that as much as possible, the entire diet is derived from whole plant foods.
That makes sense. Thank you. Does the diversity matter? You know, Dr. Will Bolshewitz, who wrote the New York Times bestselling book, Fiber Fuel, talks about 30 different plants a week. And I tend to just kind of eat broccoli every day because it's my favorite. Should we be seeking more diversity from the plant kingdom?
Well, I think there is some advantages to eating a variety of whole plant foods. And one of the things that might help determine that to some degree is seasonality. You know, not everything is available organically grown and preferably locally all year round. And so you tend to, you know, as the seasons change, different fruits and different vegetables become dominant in the marketplace or in the garden or whatever. And so I think naturally getting a variety of fruits and vegetables in the diet is good. It doesn't mean broccoli is not good, but I wouldn't just eat broccoli as the only vegetable in the diet. Different foods have different constitutional components. And so ensuring a variety of foods ensures a variety of microfloral influences, as well as vitamins and minerals, micro and macronutrients. So I think it's nice to get as broad a variety as is reasonable in the diet. You know, I think about my own diet and I realize that almost all the foods we're eating are actually considered superfoods. You know, we have berries and melons in the morning, and we have, you know, grains like oats, and then we have salads, and salads often have things like lettuce and cucumbers and red peppers and carrots and jicama and different, you know, vegetables. And you have steamed vegetables, you know, your broccoli, cauliflower, kale, chard, all the different greens. And then, you know, you have perhaps nuts or seeds or other more concentrated foods in limited quantity. When you think about it, each one of those foods could be considered, you know, a superfood because it has such an abundance of vitamins and minerals and fiber and all the rest of it. So essentially, it's a superfood diet when you really think about it critically.
Thank you. What is your favorite? I know mango is your favorite fruit, if I'm not mistaken.
Well, you know, I like mango, but I also like jackfruit. And I also like stone fruits like peaches and nectarines and berries. I think, you know, berries got to be on the favorite list too. Blueberries and raspberries. We grow a lot of berries and strawberries at our little farm, and that, you know, those are just unbelievably tasty when you pull those out. Another fruit I really like are persimmons, and we have persimmon trees, and now we've got kiwi. We had trouble with our kiwi plants, and I found out why. Is our male apparently had died. And it turns out you need to have a male. And so when we put a new plant in that was a male, now we're getting really good kiwi fruit. So, you know, kind of the favorite fruit sometimes is the one that happens to be ripe and available, you know, right there in front of you. We also have pears, which are really good. I don't know if you've had Asian pears and Comey's pears,
Oh my
D'Anjou
God,
pears.
Asian pears I love the texture of them, and I actually like the flavor better than regular pears.
Yeah, so we like those. We also have cherry trees that are good. And I have to say we've got fig trees. And the fig trees, we have both those white and black figs. They're particularly delicious. So I don't know if I could just identify one fruit, but I think I like all of those for sure.
So that is so cool that you live almost like on a farm, don't you?
Well, yeah, it is a 2 acres. We have close to, I think, 80 trees. It used to be a Gravenstein apple orchard, and we have some Gravenstein trees, including some, probably close to 100-year-old Gravenstein trees. And those Gravenstein apples are also really good. We have a variety of other apples as well. We bring them all into the center, so it's really nice to do gardening where everything you grow gets used. Sometimes you get an abundant crop of zucchini or something and people don't know what to do with it. Well, I never have that problem because we just harvest all that. We bring it into Ramses at the center, and they're able to make use of everything we bring in.
That's great. That is great. All right. So the next question is from Julianne. And she says, when we apply oil topically onto our skin, does it harm the arteries? So can it get through?
So there's a little bit of absorption that does occur through the skin, but it's pretty minimal. I don't think it's considered nutritionally significant. So the exogenous application of emollients is probably not going to be a significant issue for your nutritional lipid levels.
That's good. I remember once Dr. McDougall talked about something about some patient that had to be tube fed and they couldn't feed them with, fat in the tube, and they would rub it on the skin, and that was enough to meet the needs.
Interesting. Yeah, I know that there is some absorption through the skin, but I don't think that people are gaining weight, for example, from using emollients on their skin.
Right. Thank you. Okay, let me find another good question. Okay. Oh yeah. Okay. So Sandy would like to know, hi, Dr. Goldhamer. I hear many plant-based doctors give an example of what they consider, in quotes, the ideal day of eating to look like. Many of these opinions differ regarding including overt fats, volumes, starch sources, grazing versus solid meals. Can you please give us your version of an ideal day, including approximate volumes that you would consider minimums to be? I understand we should move away from weighing, measuring, and portion control, but just as an idea for those of us who struggle to recognize hunger and fullness.
Okay, so again, you want to be really careful because there's, people are not all the same in terms of size, energy use. So it gets really hard to do volumes accurately. But what I can tell you is that when you're eating a diet of whole plant foods, it becomes much less of an issue because your normal satiety mechanisms kick in, so you can eat. And for most people, they start getting normal satiation feedback. But to give you an example, what I like to do is in the morning, I like to have fruits, often melons and berries, and oftentimes some type of grain. Usually it would be oats, and it might be a cup of oats that would be, 2 cups of water and a cup of oats the way we cook it, and perhaps as much as an ounce of nuts or seeds. At lunch and dinner, I have a huge salad. So this is going to be close to a pound of salad. The way you can tell if you don't want to weigh it is just put it down on the table and wait for your friends at work to walk in the room, and they see it and they'll react with what's called shock and awe. And they'll often make comments like, "Oh my gosh, you're not going to eat all that, are you?" Because they can't imagine that it would be physically possible to consume, a large salad. We also use steamed vegetables, and that would be a platter that most people would think would be kind of like a family style thing that you might get in a restaurant for 4 people, but large amounts of steamed vegetables, and then just enough more concentrated food, potatoes, rice, beans, so that you don't get too skinny. So if you're eating enough food, you should be able to stabilize your optimum weight. If you're trying to lose weight, you want to eat more of the low density foods, more of the salad and the steamed vegetables. If you're trying to gain weight, maybe a little less salad, a little bit more steamed and starchy vegetables. And so the idea is you can kind of tell if you're overweight, you should be losing a couple pounds a week if you're a female and doing moderate exercise. If you're a male, you should be able to lose upwards of 3 pounds a week. And if you're not losing the weight you should, perhaps you need to be eating more salad and steamed vegetables and eating less of the more concentrated foods. And if you're losing too much weight, then maybe, you don't want to be careful that you don't end up getting weak or having issues and have a little bit more of the steamed and starchy materials.
Okay, but she has a follow-up question on that and wants to know, would your ideal day of eating include an omega-3 source of fat?
Well, I mean, it does, because we eat a lot of green vegetable material, and green vegetables are excellent sources of essential fatty acids. I also include in my diet either flax or walnuts, or we also include the my wife anyway uses the chia seeds. I have to say, AJ, I've looked at the analysis of chia and they are very nutritious, but I cannot get over those chia pets as a kid and the slimy, I don't know. For me, it's a problem. But I do acknowledge that nutritionally they look good. And she does use ground chia. I tend to use the flax or walnut. So you're getting a very concentrated source of omega-3 fatty acids when you include those in your diet.
Well, that's funny because I'm the opposite. I don't care for flaxseed because to me it's like sawdust. Like remember those
Mm-hmm.
restaurants? There was a popular restaurant like in the day where the whole floor they would have sawdust, and I just find flax seeds very distasteful and just. But chia seeds,
Right.
I love them because they're a
You
natural.
like those?
Yeah, well,
Yes,
because here's the
you
thing,
do.
they serve a purpose also as a chef in recipes. So if I want to make like a dessert that's a pudding, I can literally take plant milk, fruit, and a little chia seeds. If I
Yeah.
want to make a sugar-free jam or a fruit sweetened jam, I can take fruit and chia
Yeah.
seeds. If I want to make a salad dressing and have it actually stick to the greens and not just go to the bottom of the bowl, I can use chia seeds. So chia seeds have always been my preference.
Oh, okay. Well, there you go.
Yeah. But there, I appreciate what you said about how different people are different sizes and different ages and different metabolisms. And, people say, well, I'm always bashing the weighing and measuring programs. First of all, if it works for you, do it. But I never understood that when I used to do private coaching and I would get clients, how the exact same meal plan would be given to a 4', 10 woman and, a 6'2" man. It just seemed
Right.
like it's not a one size fits
The
all,
biggest problem I have with these weighing and measuring programs is that they're weighing and measuring and treating vegetables and salad the same way they do more concentrated foods. And so it ends up being people don't get the benefit of eating the larger volumes of salad and steamed vegetables that help them get their stretch receptors activated, help them get the nutrients density that they need. And as a consequence, they're feeling bad about eating larger volumes of things that I think can be very helpful to people. And I understand there's a rationale that people, they've got other psychological considerations, not just physiological considerations. But nonetheless, if I was going to give advice, I'd say let's pull the weighing and measuring components away from the whole plant foods and stick to the more concentrated foods if you feel like you're inclined to limit quantity and you need an objective guide to guide that. Stick to the foods that you have to worry about, which is the more concentrated foods, the nuts, the seeds, these kind of things. You don't need to do that with salad. Salad, I've not actually had a patient where I found that we had to do any type of portion control on salad or steamed vegetables. Quite the opposite.
Absolutely. That was the biggest beef, pun intended, that I've had with the program is that they limit non-starchy vegetables. I never under,
Right.
I think it's something like 7 ounces, and it's like that's like the healthiest
Now,
food on the planet. I mean, they believe that people. I don't know. I don't want to get into
but
it, but
the good news is Weight Watchers and some of the other programs have like taken the
yes.
punishment away from fruits and vegetables. So, that was very nice to see them try to at least encourage, as we would, people to eat large volumes of low density foods.
You bring up a good point that even on Weight Watchers, they're considered free or 0 points
Yes.
fruits and vegetables,
Yeah.
unadulterated ones, that is. And her last question is, would you favor legumes over whole grains or potatoes?
Well, I can tell you the advantages to each. So beans have a slightly lower glycemic index. So for people that are having problems with managing their diabetes, they may find they can eat beans with less blood sugar volatility than they would with grains. What I found with both those, if you include lots of greens when you eat your grains, you'll find that the higher fiber and other components of the greens help to regulate blood sugar levels. That also works with fruit as well. That's why we're always encouraging people to eat lots of greens when they're using, say, fruit. So lots of celery and lettuce and cucumbers and other stuff like that. It's a way of getting more of those low density foods in and helping regulate those blood sugar levels in people that are having challenges with that. So both I think are acceptable foods. Not everybody can handle beans. Some people have digestive challenges, so they do better with starchy vegetables. So not everybody can handle grains or not all grains, and so they usually do better with starchy vegetables. But almost everybody can handle a variety of starchy vegetables, your hard squashes, your sweet potatoes, your potatoes. These are generally well tolerated. So if people are having digestive challenges with either beans or grains, I just tell them to eat more starchy vegetables until their digestive system normalizes.
Well,
But think about this, most calories in the world come from grains and beans. And it's because they're the lowest cost food per calorie. So, people advocating, say, a raw fruit and vegetable diet only, it's a very elitist diet. It has 10 times the cost per calorie as it would for grains and beans. That's why if you go around the world where billions of people, making the equivalent of $3 to $5 a day, they're living on rice and beans because that's what you can afford to do when you don't, have large incomes, because those are the most cost-effective sources of calories: grains, beans, and local vegetables.
thank you. Thank you so much for saying that, because I'm a person that can't eat any legumes, and people in the plant-based world think you're going to drop dead or it's sacrilegious if you don't eat beans. But I eat all the other stuff. I once
No,
heard
you don't need to eat beans, but if you are able to eat beans, they're a perfectly acceptable low-cost component in the diet. But it's not like, oh, if you don't eat beans, you can't get all the nutrients, quantity, and quality of things you need, and all that kind of stuff.
Well, they always say the blue zones eat beans. They're the most longevity promoting food. And, nuts, the other thing is, like, people say if you don't eat nuts, you're going to drop dead too. But there's things you can get in nuts that you can get in other foods as well.
Yeah, no, absolutely. There's no individual food that's absolutely indispensable. I would say the only substance that probably is indispensable is water.
And that's what you specialize in serving.
Yep. And whether the water comes from your plants or it comes from, free water, you do have to stay hydrated. So you got to eat high water content fruits and vegetables, or you got to drink water. But one way or the other, you definitely need water. The other, it's not really a nutrient, but the other essential ingredient would be air. If you stop breathing, you die too. So
Yeah, not a good idea, huh?
yeah, we don't recommend it.
Yeah, you're funny. Thank you. Okay, so this is an interesting question from Jane. And she wants you to address an excerpt from a blog, which you don't have privy to, but I could send it to you. But basically, it's about orthorexia. And she says that when she started eating a whole food vegan diet after having some troublesome digestive issues, she never felt better. She's at a healthy weight. But according to the definition of orthorexia in this article, with the exception of a decrease in variety of foods and refusing to eat foods prepared by others, that she needs to seek professional help for orthorexia.
Yes.
Is she missing something, or is this just crazy? So the question is, when does wanting to be pure and eating healthfully turn into a disorder? Are there some red flags that a person could actually recognize the signs of orthorexia? And do you even believe that orthorexia is a thing?
Well, it's definitely a thing. It's part of the ICD diagnostic criteria now. And it's basically anybody, in the broadest definition, anybody that's overly concerned about their diet. So, like people like, vegans, and people that are worried about gluten in their diet, or people who are worried about refined carbohydrates, or, being overweight, or pretty much everybody that's trying to make a serious effort to overcome the standard American diet could, in the broadest sense, be diagnosed as having orthorexia. And the only thing they haven't come up with is a drug yet to treat it. So I'm sure that's going to be coming soon. But no, I don't agree that because people become concerned about their diet, they are orthorexic or have a neuropsychiatric disorder. It is true that people with neuropsychiatric disorders can be focused on all kinds of issues, and diet's certainly one of them. So it doesn't mean that there aren't people that have psychological difficulties, but just because you're concerned about trying to eat a healthy diet and you're outside the social norm, that doesn't make you sick. The problem is that because 72%, or maybe it's 74% as of this morning, of people who are overweight or obese, anything you do that has any semblance of health promotion to it is going to be outside the norm, because the normal people are eating greasy, fatty, slimy, dead, decaying flesh, highly processed foods. And just eating fruits and vegetables itself puts you outside the standard of care. So it is true, though, if you go to a doctor today, typical doctor, and you report, especially as a female, that you've lost 20, 30 pounds, whatever, your doctor's not going to immediately think, oh, you must have adopted a whole plant food diet and joined AJ's program and started to exercise. They're going to think that the differential diagnosis is that you are an eating disordered patient, you are a drug addict or you are dying of cancer. Because many doctors, the only people they've ever seen lose weight and keep it off are those that are dying from cancer. So your doctor's most likely going to order a stool test, look at blood tests possibly, and try to assess you for drug addiction or having an eating disorder, including maybe diagnosing you as orthorexic.
You know, it's interesting. Obviously I can't read the whole blog, but this list, I mean, some of these are refusal to eat food that wasn't prepared in a way they consider pure.
Mm-hmm.
You know, so
Yeah,
that's
or refusing to eat food that's full of salt, oil, or sugar, refusing food that includes animal products, meat, fish, fowl, eggs, and dairy products, refusing to, basically any level of consciousness or concern about what you're putting in your body would be considered a problem.
yeah, they're saying it's a serious disorder which requires professional help.
Like I said, all they're missing is a drug.
Yeah, thank you. Thank you, Dr. Goldhamer. So let me hop over and switch screens to Instagram and ask a question from an Instagram viewer named Deb Ski. On a plant-based diet, how many bowel movements should you have a day?
Well, that will depend on a number of variables. Number one will depend on how much you eat. It'll depend on, how your individual anatomical structure is. So I don't think the frequency of stools is necessarily going to be a one size fits all. More importantly, we would like that you have what are considered normal bowel movements. So you wouldn't want to have diarrhea or liquid stools. You wouldn't want to have hard stools. So you'd want to have stools of, normal constituency, and they're hopefully pain-free and not involving mucus and blood and distress and bloating and all kinds of other secondary symptoms that people have. But so many patients will certainly have one or two bowel movements a day. Some people have a bowel movement in proximity to each meal. If you're having multiple bowel movements a day, though, so let's say people are having 5 or 6 or 8 or 10 or 20 bowel movements a day, particularly if those bowel movements have pain, blood, or mucus associated with it. There are conditions like Crohn's disease and colitis that can be, associated with high-frequency bowel movements in appropriate formation. That we would want to try to address clinically and figure out if you're eating something you're sensitive to, if there's problems with the restrictions or adhesions in the colon, or if you have autoimmune disease that's contributing to the problem. So yes, people can have too many bowel movements, people can have too few bowel movements. That's the more common problem. Some people are only having bowel movements once a week, and that's not a normal situation. It's reflective of a diet that doesn't have adequate fiber, or you don't have the normal gut microbiome. Remember, most of the stool is bacteria, and that bacteria is associated with the type of organisms that live in your gut. So if you eat a whole plant food diet, you're going to have different bacteria than your colleagues that are eating all the animal foods and highly processed foods. That bacterial microbiome is thought to be an important part of the immune system. Healthy vegetarian diets on whole plant food diets are going to be getting as many as 1,000 different strain of organisms, maybe 5 pounds of creatures swimming around in your gut there, eating, swimming, and defecating inside you. And so what your gut microbiome poo in you depends on what you feed them. You feed them healthy foods, you get healthy bacteria, diverse bacteria. You feed them animal foods, you're going to get a lot of TMA, and that's going to increase your risk of colon cancer and heart disease and other problems.
Remember that commercial, Dr. Goldhamer? Normal is what's normal for you.
Yeah.
A long time ago. Okay. All right. So another Instagram viewer is asking, it's not a very specific question, trine. Can I ask about results from fasting for more than 3 days?
Yes. So fasting in our clinic ranges from a few days to a few weeks up to 40 days. And it's not linear. So in other words, three-day fasts are not the same thing as a 9-day fast. As you get farther into fasting, there's a more profound impact. So for some people, a short fast is really the best option for them. They don't necessarily have the reserves to do a very long fast, or the motivation or the condition that would require that. Other people, though, have conditions that will require a much longer period of fasting to get the desired results. Sometimes they won't see the start of results until they're very deep into the fasting process. So again, it's a very individual situation. But the conditions that we see respond to fasting are usually conditions associated with dietary excess. So obesity, cardiovascular disease, diabetes, autoimmune disease, and some forms of cancer like lymphoma have been demonstrated to be highly responsive to fasting. And that, again, that fasting range will be from 5 to 40 days. And a lot of times you don't know exactly what's ideal till you see how the person responds to fasting itself.
Great, thank you. Here's a really interesting question. I don't know if you've ever answered it before, at least I don't recall. It's from Natalie. Should people in a coma be eating? I was wondering if their healing process would be better if they fasted during that time and the doctors and the hospitals would limit or stop the artificial feeding.
Well, I think that would be a bit of a problem because part of feeding is maintaining hydration. So you have to get fluids in at the very least. And we don't work with comatose patients. And so as a consequence, I really don't have any experience in the care or the feeding of comatose patients. We don't use we're not treating people on feeding tubes, et cetera. So I really wouldn't be the best person to answer the question about how's the best way to manage people in comas. I would say that you do have to maintain hydration. We also don't advocate dry fasting for patients without water, even though that's become a more popular topic of discussion. I don't believe that dry fasting is physiologically sound. I think you need a solute, in this case water, in order to put the materials that the body's detoxifying and get it out. The way detoxification occurs in fasting is largely through the kidneys processing the blood, and that's eliminated in the urine. It's actually monitoring the urine and kidney function that's really one of the more critical parts of fasting, not so much the bowels. Bowels are the stuff that never got into the body.
Well, what I'm thinking about is not necessarily people in comas, but people that are fed like in tubes and stuff. They don't feed them very healthy things.
Well, no, they're feeding them, essential nutrients and, trying to keep them functioning. But again, my area of expertise is not in patients that are not able to feed normally. So I'd hate to start speculating about the way to manage patients, in an area I've not been trained and don't have experience.
Absolutely. But what I'm saying is there are some doctors, like I remember Dr. Furman was able to get some patient at least something healthier to feed them with while they were recuperating. Anyway, she has
And I would absolutely refer any patient I had that required that to Dr. Joel Furman, who's a wonderful doctor. And if he's got experience with it, that's great.
Yeah, he was able to either order something or have something like healthier put in the tube. Anyway, her second part of her question is, when is the best time to eat fruit? As a mono meal, more in the morning, before my big meal, or after? I assume digestion-wise, it's best to eat fruit first or earlier in the day. But if I start my meal, but if I should start my meals with the lowest calorie density, this would mean to start with vegetables, right? What does Dr. Goldhamer suggest?
Well, I think that, you can use fruit as a part of, any healthy meal. But if you're eating fruit, I always recommend that fruit be consumed with some greens, because we find that the fruit today is pretty high sugar, low fiber, hybridized foods that have, not necessarily the natural foods that they would have been. If you go to Hawaii and look at, wild apples and stuff, they're very fibrous. They don't have the high sugar bolus, low fiber content. So if you eat greens with the fruits, a lot of people find they're able to avoid overeating on the fruit. They're able to get better regulation of their blood sugars as they respond, because the fiber slows down the rate of absorption. So it makes it an easier to tolerate, less tendency to overdo situation. But yeah, and I do use fruits in the morning because there's usually less time between breakfast and lunch than there's between lunch and dinner in my life. And so I tend to have a bigger meal at lunch and then another meal at dinner, whereas the breakfast meal usually comes a little bit later after I've had a chance to play basketball.
Nice. That's okay. Well, the most important thing is people do eat fruits and vegetables, right?
Yeah, again, the ordering and all of this depends on your life, your circumstance, and what seems to work best for you. It's good to do some experimenting and find out what's the best pattern for you. I would suggest, though, not eating very large meals very late at night. We want to have people not eating 3 to 4 hours before they go to bed, so that they can burn the foods that they eat, not have to turn their foods they're eating at night into fat, not disrupting the quality of their sleep because they're eating because they're tired and angry and frustrated, and eat because you're hungry, not because you're looking for the stimulation of food to deal with the fact that that you have stress in your life.
Yeah, thank you. So let me look if there's any questions on one of the other sites. Yeah. I'm just curious, is there a question that you get asked more often than any other question? Like for
Where do
me,
you get your protein from?
well,
You know,
me
people
too.
are so deluded about the need for protein, how protein works. They've really been miseducated. And they've been taught that what's good for short-term muscle gain is what's good for long-term health. And there's nothing that's, farther than the truth. What's good for short-term muscle gain may not necessarily be a good long-term health strategy. And so when the trainers are telling you to eat large amounts of animal food because you're going to get bulkier faster, I would take that with a grain of kelp. Let that go. You eat a whole plant food diet. When you're exercising, you will get more protein because you're eating more calories when you're exercising vigorously. You don't need to eat a higher calorically dense diet in order to do that. You just need to eat more during your feeding window.
Great. Thank you. Um, so, I saw this article and I haven't clicked on it yet, but supposedly now there's going to be an Ozempic pill. So will that be better than the shots?
Well, for the company, in terms of making money, absolutely. Some people are reluctant to inject toxic waste in their body. They're much more willing to take toxic waste orally. And so as a consequence, there'll be a much bigger audience. And the great thing from these drug companies' viewpoint on these pills is that, first of all, you have to take them the rest of your life, because once you start them, you stop them, you're going to blow up. Number two, instead of saying, we'll adopt a whole plant food SOS-free diet, like really radical people are saying, they're saying, oh, no, you keep eating your highly processed foods, but you take this drug and you will feel sicker quicker and be satiated sooner. And so you won't eat as much, so you'll lose weight. And so over the short run, that's probably true. People do lose weight when they use these medications because they feel fuller. And, the sicker you feel, the less you're inclined to eat, by the way. Second of all, it doesn't require you to change your diet. They don't suggest you change your diet. You just won't eat as much of the highly processed food. Now, there's an advantage to that. You lose weight and you lose fat. The disadvantage, though, is as long as you keep eating the highly processed foods, eventually that's going to catch up with you. And either that'll catch up with you or the side effects from the drugs, the gastric motility issues, all, et cetera, all the downstream consequences of these drugs. But one way or the other, it will catch up with you. And you're already starting to see AJV lawsuits, the class action suits where people feel like they weren't being fully informed about the long-term consequences of taking these magic pills and injections. But from a drug company standpoint, it's brilliant. They're making billions of dollars. They're trying to make it a social class issue and make it available to poor people as well as rich people. And so that a higher and higher percentage of the total healthcare expenditures can be put into giving these companies, I think they're from France, incredible incomes on drugs that aren't even necessarily used in their home countries in the same way. So,
Oh my gosh. Do you have people on the center that come in on these drugs? Because people can't be on pretty much any medication when they're fasting, is my
well,
understanding.
we have people coming in on every medication you can imagine, and our job is to help safely, when appropriate, withdraw those medications and help them get healthy enough so that they don't need to use those medications. Frankly, most of the people that we're seeing recognize that even if this is a short-term aid, it's not a long-term strategy. Most of our people are not only looking to lose weight and get healthy, but they're interested in making the last 20 years of their life healthy and happy instead of miserable. And so, our focus in our draw is usually on people that are trying to get healthy, not just trying to do short-term weight loss to fit into a different dress for a party or something.
Thank you. Here's a question from Nat. She'd like to know, can a certain amount of fasting help with lowering certain hormonal levels? Can naturally high testosterone levels in women be decreased by fasting? I'm a 24-year-old female having very pretty testosterone, maybe that's the wrong word, levels, eating a predominantly whole food plant-based SOS-free diet for 6 years, getting enough exercise and sleep. I was wondering if cortisol and adrenaline levels can also be reduced by long-term fasting and have long-term effects on the body.
Yeah, we're just starting to learn about all the different ways that hormone balance seems to be normalized in fasting. Here's what we know. For 40 years, we've been fasting women that have a series of problems like fibrocystic breast disease, dysmenorrhea, polycystic ovarian syndrome, uterine fibroid tumor growth, menorrhagia, dysmenorrhea. These conditions are all common problems unique to women. And one of the common thoughts in all these conditions is high estradiol levels. Estradiol is normally broken down into something called estriol, and it's excreted in the urine. And what breaks estradiol down to estriol is the microbiome that lives in your gut flora, and your liver function. And both of those are profoundly affected by fasting. And that may be one of the mechanisms by which these patients that have these problems are consistently resolving those problems. So the menorrhagia, the dysmenorrhea, the fibrocystic breast disease, the PCOS, et cetera, often improve dramatically with fasting. We hadn't always known how it's improving, but that may be one of the ways. Normalization of hormonal function by normalization of gut microbiome and liver function.
Thank you. Here's a question from a live viewer named Linda, and she wants to know what causes elevated liver enzymes, and will this go down with fasting?
Yeah, one of the great things is that, when there's inflammation in the liver, and that may be detoxification, it may be, infection, there's all kinds of things that can be causing those cells to break down and release, like ALT, AST, SGLT. Those liver enzymes that are elevated often resolve with fasting. And in fact, we now have evidence on fatty liver disease itself reverses with fasting and the markers associated with that. And you can go to our websites at TrueNorthHealth.com and download the articles and actually read the scientific papers we've published on the normalization of these markers as well as these disease processes. So we think a lot of it's the detoxification and the normalization of the diet afterward that allows fatty liver disease and non-specific liver dysfunction to heal. Now, interestingly enough, AJ, during fasting, they often go up sometimes dramatically, just like cholesterol can go up dramatically during fasting, because you're actually going through a healing crisis that increases inflammation, because inflammation is what the body's using to heal. The problem is with chronic inflammation, the body's not actually healing, it's being persistent, and that's where you end up with cardiovascular disease, cancer, et cetera. But when the body treats an acute response, you'll see these markers go up, but then when you follow it, they'll normalize. You look at people 6 weeks post-fasting, not only have they come back down, they've actually normalized.
Wow, thank you. Have you been on any other great podcasts lately that we could listen to you on?
Yeah, I did, 3 years ago, I did a show, thanks to you, with Rich Roll, and it's been very successful. It's had 4.2 million views and counting. And then a few months ago, I did another show. This was 3 years after the first one. And that one has also been very successful. It's got 360,000 views and counting. And we've gotten tremendous exposure from Mr. Roll. He is an interesting interviewer. And in that, unlike many people out there, he'll actually read the book and, get himself educated about the topic that he's discussing. And so I think it makes him an interesting and effective interviewer. I've listened to many of his shows now, and he does a really good job of getting inside, the actual content, whereas many people don't actually, not apparently that interested in the actual details, but he does a great job. And as I said, it's been really helpful, not just by quantity of exposure, but quality of exposure. The other person that I found has been tremendously helpful to us because of the quality of the people that are listening to their show is actually you. We see more people proportionally from your podcasts than anything else. And even though it's not as big an audience as some of these, massive podcasters, the quality of the audience, the people that are actually listening are actually motivated to make changes. And so that's been really impacting. In fact, if you ever watch our live stream, AJ, you'll notice that there's always people from your podcast.
Well,
every
Dr.
single
Goldhamer,
time.
I watch it. I watch it every Monday, and at 2 p.m., the first thing you say is, "Where did you hear about the TrueNorth Health Center?"
AJ.
And it's like, Chef AJ. I'm still waiting. I'm still waiting for that referral check, Dr. Goldhamer.
Yeah. Well, you can keep waiting because it's called steering, and that's actually illegal. Any facility that accepts and treats Medicare patients is not able to financially compensate people that steer and generate. And I know that you're not interested in anyway, but one of the things.
First of all, I'm kidding, by the way.
Yeah, I know you are, and I'm not, because what we do is we don't do any marketing promotion. We don't do any of the affiliate situation, and you really can't. I know people do, but it's actually not legal for people that are treating patients that receive Medicare, et cetera. There's very specific rules about that out there. And so we don't participate in any kind of steering behavior or anything else that could put us in the target. One of the challenges involved in doing research, particularly in something as radical as fasting, is that there's lots of people that disagree with us and consider us criminal quacks and, crazy people. And so we have to be particularly meticulous to try to follow all the rules and not put ourselves in a position where we can be criticized for those types of behaviors. And we don't engage in any type of steering behaviors. Yet, fortunately, there's enough people that like what we're doing that we're still here and busy 40 years after starting.
Great. No, thank you. Instagram viewer named Suze wants to know if there are any tips for getting her cycle to return post-pregnancy. Her daughter turns 2 in December. She stopped nursing 5 months ago. She runs 3 miles a day and eats about 1,700 to 1,800 calories a day.
Yeah, my suspicion would be is that if a person is underweight, or under fat, in other words, if they're too small for their ideal, they may not be producing the hormonal components that are necessary in order to ovulate and menstruate. And so I would say that it would be worth doing a consultation with one of our telemedicine doctors, either Dr. Chilla Vares or Dr. Peter Sultana would be excellent, who can help you maybe get a little bit of testing done and evaluate. Maybe there's something still not quite in balance. Ovulation will obviously be suppressed if you're breastfeeding post-pregnancy. So, there's a number of variables there, but it'd be worth taking a look and seeing if you're concerned, have Dr. Vares or Dr. Sultana help you kind of look at what's been done or get ordered testing so that you can figure out what you need to do to get your system back where you want it.
Okay, perfect. Thank you. Trine would like to know, is it true that when you go through longer water fasts, your skin will shrink with weight loss?
It is true that there is a different type of mobilization during fasting of fat than there is, with other types of weight loss programs. But I don't know that it's been well studied. We certainly haven't done any research specifically quantifying it. So the general observation is there does seem to be a different response in how the body's breaking stuff down. But I don't know that we can get real specific or make a lot of claims about it yet.
Okay, thank you. And Olga wants to know, is there a list of juices that are used at the TrueNorth Health Center when people refeed?
Well, we use a variety of juices depending on the patient and their history. So we're mostly interested in identifying things people may have been sensitive to. Most typically, when we break fast, we're using one of our favorite juices is watermelon celery juice. And the reason is watermelons are typically picked ripe, so you don't have an acidity problem with them. They are a lower sugar, higher mineral content juice. And the celery provides some electrolytes and other materials that are useful. So we often use watermelon celery juice. We also use apple celery juice and carrot celery apple juice. We use a green juices, which has cucumber and zucchini and other greens in it. We also oftentimes we use a fresh vegetable broth that we make that can also be useful when we're trying to get more electrolyte-rich materials in. What we typically don't do for most people are, say, citrus juices or things they might be a little sensitive to when they first come off the fast. So we're trying to stick to things that we know are really neutral: carrot, celery, cucumber, apple, watermelon. These are components that we use extensively. They're available year-round. And, we grow like lemon cucumbers. We grow zucchini. We grow a lot of greens. And so, we have reliable sources of a lot of those materials consistently.
Great, thank you. Jennifer wants to know, if you eat a whole food plant-based diet, but your stools are small, does that mean you need to eat more food?
Well, first of all, I don't recommend a whole food plant-based diet. I recommend an exclusively whole food diet. I don't know what plant-based necessarily even means, but I do know what a whole plant food diet is, and that's whole plant foods. And so I'm sorry, the question was,
if you have small stools, do you need to eat more food? Remember, who was it?
If your stools are not overly hard or soft and you pass those without pain and difficulties, I wouldn't necessarily be concerned about that. However, if you're having difficulties with stools, sometimes it's a question of getting enough fiber, usually not a problem on a whole plant food diet. Sometimes people have irritation in their colons secondary to eating something they're sensitive to. And so sometimes we do have to eliminate food sensitivities. For example, there's about a third of the population seem to be sensitive to gluten, which is a protein found in wheat, rye, and barley. And 1% of the population have celiac disease, which is very serious. Another percentage have Hashimoto's thyroiditis, which, is also thought to be contributed to people that have the HLA-DQ gene and eat gluten. The immune system can attack the thyroid, which is what Hashimoto's thyroiditis is. Some people get osteoarthritis or sinus sensitivities, asthma, skin problems that are also sometimes helped by eliminating gluten from the diet. So, different food factors can affect different people in different ways. Sometimes post-fasting, we'll rotate food in and watch and make sure somebody's not having a sensitive reaction to a specific food.
Yeah. Here's an interesting question from Sal. Dr. Goldhamer, how long do you think you'll live?
Well, I think we won't know how long you live kind of until the end because, I may get shot in the head by some crazy person any day. I'll piss a lot of people off. May get hit by a bus. Lightning can strike. So you never know exactly how long somebody's going to live. What I want to hope, though, is that I can live until I die, that I can live fully functional until I go to sleep one night and not wake up. That I want to make the last 20 years, whenever they are, of my life, hopefully the best, most enriching, most enjoyable years of my life. I do not want to find myself unable to talk or move, lying in some nursing home bed waiting for people to come and change my diaper. So, what I'm fighting for, not knowing how long I'm going to live, but trying to make, hopefully those last 20 years the best 20 years. And I hope that, I'm yet to have started those last 20 years, but we really won't know except in hindsight, will we?
Yeah. Well, did you have your parents, they lived pretty long?
Yeah, my mother passed away at 93, and my father passed away at 88. But neither of them really had the benefit of a whole plant food SOS-free diet until very late in their lives. They were both had significant health challenges by the time I was able to influence them to adopt a whole plant food diet. And I think they did exceptionally well, considering the circumstances that they began with.
Great. I probably have time for one more question, maybe two, depending on how long your answer is. And this is from Maynard. Dr. Goldhamer, can you talk about salt?
Yeah, salt is an essential nutrient. Without salt, you die. So you have to get sodium in your diet. And fortunately, all the salt you need in your diet comes from a whole plant food diet. And if you eat a whole plant food diet, you get the gram of salt a day, thereabouts, that you're going to need. You don't need to add lots of added salt any more than you need to add added sugar or added oils to your diet. You'll get the whole plant food diet. You'll get the food you need. And particularly if you're eating enough vegetable materials, which are very rich in all minerals, including sodium. Some are richer than others, like celery and chard and tomatoes, have quite a bit of sodium into them. And when you're on a whole plant food diet, you'll actually be able to pick that up and taste that, as your palate normalizes. So typically we're trying to avoid salt to the diet. There are exceptions. There are people, for example, people with hypoparathyroidism don't make mineral chlorokides. They can't absorb minerals from their diet. Well, they may need to have a higher sodium concentration than maybe people that don't have that type of debility. But that's, relatively unusual. You're going to maybe get some contamination of salt in the diet if you're eating, even on a whole plant food diet. If you eat corn tortillas, for example, there's going to be some sodium in there. Generally, relatively small quantities. The still sodium intake in the diet is still going to be less than 1,500 milligrams a day, even if you're eating a few foods that might have a little of salt contamination. There's some general rules of thumb. You certainly don't want to be eating foods that have higher than a milligram of sodium per calorie, that's for sure. And you want to make sure that overall the diet is going to be low in any added salt. The best diet is probably a vegan SOS-free diet where we're not adding any salt to the diet. It's very difficult to do that if you're eating other people's food or eating out, just because even foods that you think are going to be salt-free oftentimes have some contamination. And so, it's probably the most difficult challenge is keeping sodium down, but it's also one of the more rewarding consequences, because it's not just high blood pressure and joint pain and edema and congestive heart failure that are aggravated by salt. It also affects the microbiome in the gut. It impacts things like osteoporosis. There's a lot of downstream consequences from eating too much salt, not the least of which is passive overeating. And it's very difficult to get people to lose weight and keep it off if they're eating a high salt diet, because it stimulates passive overeating. And so even if they're eating relatively healthy foods, they're going to eat more of it than they would if they weren't fooling their brain with adding this chemical to their diet.
That makes sense. Well, we're just about at the top of the hour. Maybe you can answer this really quickly. Why would somebody that is now on a diet, I think it's the carnivore diet, or just, why would they have better, here it is. Why would someone be clinically better, weight loss, no sore joints or brain fog on a totally carnivore diet that is just
Absolutely.
meat, salt, dairy, and eggs?
Yes. Well, short term, they may be, because they're gotten rid of the 70 or 80% of calories that comes from highly processed refined carbohydrates. The ultra processed foods are causing devastating problems, from obesity to heart disease and cancer. So when you get those out of the diet and you're just leaving, say, the animal food behind, keep in mind, many of those people were already eating animal food 3 times a day. So now they've stopped eating all these refined carbohydrates. Short term, they may lose some weight. They may get some clinical benefits. They may, the refined carbohydrates cause everything from colitis on down. Short term, they'll get some benefit. Long term, of course, high fat, high protein diet leads to predictable problems ranging from gallbladder disease to constipation to premature death and disability with heart disease and cancer. So again, what's good for short term gain, not necessarily good for long term health. But just about any diet, even the dead Dr. Atkins diet that gets rid of refined carbohydrates, is likely to demonstrate some clinical improvements. But it's not because they're eating the animal foods, it's because they're not eating the highly processed refined carbohydrates.
That makes sense. Well, thank you so much, Dr. Goldhamer, for another amazing show.
Thank you,
All right.
AJ.
Take care, everyone. And our next show, Dr. Goldhamer and I, actually, there's still time. We'll be together with other wonderful presenters at Farm Days, Dr. Ron Weiss's event at Ethos Farm next Saturday and Sunday, or this coming Saturday and Sunday. And we'll also be at the Plantrician Conference the week after, the 20th to the 23rd in Orange County. And I believe tickets are available for both. Take care, everybody.